By immunising our children, we aim to save them from the distress, crippling effects and sometimes death from many childhood infectious diseases. Some of these diseases are not at present common in our community because of immunisation. It is important that we keep it that way. Hello, I'm Alex Wildman. Today's program briefly profiles each of these infectious diseases so that you may be better informed when the time comes to immunise your child. Pertussis or whooping cough is transmitted from one person to another through the air and may cause a severe respiratory tract infection in babies and young children. The name whooping cough came from the whooping sound which is made as the child tries to recover from prolonged coughing attacks. It is sometimes followed by vomiting. This can continue day and night for 6 weeks. The whooping sound does not occur in babies and therefore the diagnosis may be difficult. The thick, sticky mucus in the airways can result in a severe lack of oxygen to the brain. In the UK in the early 1970s, there was a concern in the media about possible adverse reactions to pertussis vaccine. Usage fell and epidemics followed, resulting in at least 30 deaths. This boy is suffering from tetanus because tetanus germs in soil were embedded in a wound in his leg. These germs produce a highly potent toxin which causes painful spasms of the muscles. The muscles of the face are affected, causing a fixed facial grimace and a spasm of the jaw muscles known as lockjaw. Body muscles go into severe painful spasms. Even with modern treatment, tetanus can still be fatal. Most cases of tetanus in Australia currently occur in older age adults who have not been immunised or had 10-year boosters. This child is struggling for breath because a diphtheria membrane is blocking his airway. Diphtheria is spread from person to person, predominantly through the air. It attacks the back of the throat and the upper part of the respiratory tract. A thick yellow-grey membrane is formed and produces a powerful toxin which can spread into the tissues, causing a swelling of the neck. The toxin can also spread into the blood and damage the heart and many nerves, producing muscle weakness. The membranes can block the air passages and cause death by suffocation unless relieved. In the decade 1926 to 1935, before the introduction of diphtheria immunisation in Australia, there were over 4,000 deaths from diphtheria. In recent years, there have been none. Haemophilus influenzae type B, or HIB, is a virulent germ which causes a variety of infections, including severe infection around the eye and pneumonia. HIB was the most common cause of childhood bacterial meningitis, especially under the age of 2 years. Children are at risk up to the age of 5 years from epiglottitis, which is an inflammation of the top of the windpipe. This can obstruct breathing and may cause suffocation. Since the introduction of HIB vaccines in Australia at the beginning of 1994, the numbers of children with invasive HIB disease have fallen dramatically. This child is suffering from the effects of the polio virus. The polio virus is usually swallowed with contaminated food or water and multiplies in the gut. The virus causes meningitis, often followed by paralysis of the muscles of the limbs or trunk or the muscles of breathing and swallowing. In the 1940s and the 1950s, polio caused many thousands of cases of permanent paralysis and many deaths. An effective immunisation campaign can rapidly control polio, but if we don't continue to protect our children, polio can reappear in Australia. Hepatitis B causes 2 million deaths a year worldwide. This boy is jaundiced, that is yellowed because of acute hepatitis B. The hepatitis B virus is extremely resilient and infectious. It can be spread via blood, semen or saliva and other bodily fluids in many ways. A carrier mother can pass the hepatitis B virus to the newborn child either at or after birth. Hepatitis B can be transmitted through blood products or unsterilised instruments and needles. Hepatitis B can also be transmitted sexually. A chronic infection may lead to the scarring of the liver and even cancer. This can be prevented with hepatitis B vaccination. This child has measles. Measles is a highly communicable respiratory-borne infection which starts with a fever, running eyes and nose, cough and blotchy rash. The eyes are very sensitive to light. Bronchitis, middle ear infections and pneumonia commonly follow. However, 1 case in every 1,000 may develop measles encephalitis, an inflammation of the brain which can be fatal. 1/3 of survivors are left with permanent brain damage. Immunisation not only controls measles but reduces disability and deaths from pneumonia and encephalitis. The mumps virus causes painful swelling of the salivary glands and appears in the saliva of sufferers. It may be transmitted in the air or by contact with infected saliva. Complications include meningitis and, in males, inflammation and swelling of the testes, which can be severe. Pancreatitis, arthritis and occasionally deafness on one side can occur. The German measles or rubella virus is usually a fairly mild respiratory-borne viral infection which produces a fine rash all over the body. However, rubella acquired in the first half of pregnancy may result in severe damage to the unborn child, including heart defects, deafness, brain damage, damage to eyesight and even blindness, as in this child. These children are brain damaged from congenital rubella. These figures from the United States show the reduction of rubella cases achieved by immunisation. A healthy lifestyle, good food and plenty of exercise is important for every child. Unfortunately, a healthy lifestyle alone will not protect your child against any of these severe infectious diseases. The National Health and Medical Research Council immunisation schedule is designed to protect the young child against 8 infectious diseases, namely diphtheria, tetanus, pertussis, that is whooping cough, Haemophilus influenzae B, poliomyelitis, measles, mumps, rubella, and it is proposed hepatitis B. No medical or surgical treatment is entirely without risk, and the occasional vaccine recipient may react adversely to a vaccine. However, severe reactions are extremely rare. All the diseases you have just seen are preventable by vaccination. If we do not keep our children immune, these terrible diseases will return, as diphtheria has in Eastern Europe, or become more prevalent in our community. Remember, if vaccination doesn't catch on, disease will.